Hello everyone, this is Dr. Bogdan Moldoveanu, and today I'm joined by my good friend Dr. Mile Churlinov from Bulgaria, which will be joining us at Reendo meeting this year.
Hello.
And he's going to have a fantastic presentation. He's going to talk about a subject which I'm sure you're all very interested in, but maybe you didn't have the chance to put it in good practice. Let me just tell you that I'm going to be in the very front seat joining his lecture because this is also a topic that I'm very interested in. So hopefully you'll join us. But in order to give you a little bit of a taste of what he's going to talk about, I'm not going to let Mile give you an insight about his lecture.
Hi, everybody. Hi, Bogdan. It's always a pleasure to speak with you. I can't wait to see you in person once again. And thank you for inviting me to a beautiful Congress. I'm sure it will be very, very nice. The topic I'm going to speak about, it is something I started doing 7-8 years ago, and I have this follow-up for 8 years that this technique really works. It's easy to use. It's not something fancy. It's much easier than a lot of procedures we do in endo, and it's very interesting, not just for endodontists, for surgeons and for prosthodontists, because I'm going to speak about intentional replantation, not in the posterior zone, but in the anterior zone. All the cases I'm going to show, and they are a lot, will be in central and lateral. There will be central and lateral incisors on young patients from 20 to 35, 40 years of age. So this is gonna be very, very interesting. Every time I have this presentation, I really see that people are really enthusiastic about it and they enjoy the material a lot.
Okay, so basically we can invite also prostheticians and the people who are interested in obtaining great aesthetic results in very, let's say, to the limit scenarios. Am I right?
They are like beyond the limits, because limits is once, and all of the cases, or maybe 90% of the cases I'm going to present, were cases sent for extraction. Like they were dead and buried, like doomed. And with this technique, it was possible to maintain them at least for a few years. I mean, we still haven't extracted none of them, but having the fact that this was sent for extraction and you give a second chance, it is something which is really, really accepted very well from the patient and from the referral. So make sure that stay for this presentation, because you will be, we are having conversation after the presentation for sure. Every time there are so many questions about this technique.
Yo, I'm really looking forward to it. Just like I promised you, I'll be right there up in the front row. And yeah, people, join us. Get rid of your endodontic nightmares. Reendo meeting 2025. Visit beautiful Transylvania in wintertime. You'll definitely enjoy it. See a fantastic presentation from Mile and also other great presentations. Just follow us on Instagram, and these small talks will be with every speaker in order to get you up to date about what you can find out. So Mile, once again, thank you very much for taking the time to talk with me. I'm really looking forward to meeting you again and to listening to your great presentation. And in the meantime, all the best, my friend.
Thank you for having this conversation, and really looking forward to see other speakers' presentations and to meet the Romanian audience, which I truly admire, and I can't wait to share my presentation. I've been many times there, but I think this one is the best presentation I not produced, but because I put a lot of emotions in this presentation, so it means a lot to me, and I'll be very glad if you come and so we enjoy all together.